Welcome to our webinar this afternoon. We are going to just give a few seconds for those of you who have been in the waiting room to populate into the webinar, and then we will just dive in. We are really happy that you've been able to join us today for this conversation on certified wellness coaches and the new opportunities for school-based health and wellness centers. So I'm just going to pause for another few seconds and then we'll dive in. Okay, I'm going to get started. I see there's a good group here. Again, thank you. My name is Amy Blackshaw, and I'm the Behavioral Health Project Director at the California School-Based Health Alliance. We're really, really excited to have this conversation about certified wellness coaches and have a great panel to share with you today. So we are going to be recording today's webinar. So anyone who registered will receive a follow-up email with the recording, with the slides, and any other supporting materials that we provide. And we will have a few minutes at the end for some questions. So feel free to put those in the Q&A and we'll try to get to as many questions as we can. I know some of you submitted some questions ahead of time. We will get a lot of those answered through our presentations. But again, feel free to put them in the chat if what you're looking for didn't get answered. So before we get started, I just want to say a few words about the California School-Based Health Alliance. We are a statewide nonprofit, and our mission is really to focus on improving the health and academic success of children and youth by advancing health services in schools. So our work is really based on two concepts, which is that healthcare should be accessible and where kids are, and that schools should have the services needed to ensure that the health of students is not a barrier to learning. And we do this through capacity building, through technical assistance, through convenings and workshops and webinars like this one. We identify experts in the field and share best practices around the state. We offer a lot of written tools and guides to build capacity and support the growth and expansion of school-based health centers and wellness centers across California. So if you don't know this already, we host an annual school health conference. It's every spring. Oops. And this year we'll be in Anaheim at the Hyatt Regency, Orange County on April the 28th and 29th. So please save the date. We'd love to have you attend. And if your organization is not already a member of CSHA, please consider joining. It offers a really steep discount for our conference. And so if you have more than 2 people from your organization who plan to come, then it definitely pays for itself to become a member. We also offer technical assistance tailored to your organization. And Allie's going to drop some links in the chat so you can connect with us. Okay, we're going to dive in. As many of you may know, the new profession of certified wellness coaches is part of CYBHI, the Children and Youth Behavioral Health Initiative, which seeks to reimagine and transform how we support the well-being of children and youth. So this goal is really to ensure that students receive the support that they need when and where they need it, and in ways that are most accessible and responsive to their needs. So the certified wellness coach profession is really a key component of this, aiming to expand the behavioral health workforce while bringing much needed support into schools. And this support is one that reflects and resonates with the diverse backgrounds and lived experiences of California's students. So we see this really as an opportunity to enhance school-based health and wellness centers. And we're excited to have folks that have some expertise in that here for you today. So you're going to hear from a host of folks today. You're going to hear from the state leaders who have designed and who are implementing the wellness coach profession. Additionally, we have 4 of our school health partners here representing schools, school districts, and county offices of education. They're going to share their experiences as recipients of the Wellness Coach Employer Support Grants. sharing how they plan to utilize wellness coaches or what they're already doing to incorporate wellness coaches into their programs. So much thanks to our presenters. I'm sure that you're going to find it useful, inspiring, and hopefully very relevant to your work. So we have from the state, Ann Powell, who is from the Department of Healthcare Access and Information, which we call HCI. Also supporting her is Christian Jones from HCI. From Cirrus Unified, Christina Alviso, Sarah D. Duncan from Eureka City Schools, Lauren Fine from Santa Cruz County Office of Education, and Tanya Calabretta from Santa Clara County Office of Ed. So we're going to start with Anne, and then we'll just pass it through to all of our wonderful guests.
Thank you very much, Amy, for the opportunity to talk about the new certified wellness coach profession. Next slide. So it's important to understand that the purpose of the wellness coach, just like the Children and Youth Behavioral Health Initiative is focused on children and youth through age 25, the wellness coach also is focusing on serving that same population. It's a provider type that is designed to provide preclinical supportive services to help children and youth with social and emotional development and address any issues that come up for them through referral on site or into the community. Next slide. So I want to put the wellness coach in place, sort of in the work system. The ecosystem of the pipeline. So you've got your certified personnel, like community health workers and peer counselors, and then you've got your associate and bachelor degree certified wellness coach 1 and coach 2. The associate is a level 1 and the bachelor is a level 2. And then subsequently, if you were to go on and get a master's, you could become a PPS staff in a school or just work in a community setting, such as I used to do in the old days. Or you could continue on and become licensed. Next slide. So let me talk a moment about what are the competencies and services of a wellness coach. So our expectation is that a wellness coach will be able to provide wellness promotion and education, screening, care coordination and extension, individual support, group support, and crisis referral. We also expect that a wellness coach for certification will have skills in cultural responsiveness, humility, and mitigating implicit bias, as well as demonstrate professionalism, ethics, and carry out legal mandates as a reporter. They'll have good communication skills, and they'll need to be able to work in different roles and in their role in different environments, whether it be in a community health center, a school site, or some may even do home visiting. Next slide. So I'm going to break each of these out a little bit and talk in more detail. So the wellness promotion and education encompasses classroom presentations on a variety of skills and other kinds of content. And the point here is to provide information that informs students at any grade with age-appropriate content to understand and gain some insight as to what they're experiencing, be able to give words to that, and then to know that they have someone that they can reach out to subsequently if they're experiencing need and want support. They'll lead campus wellness activities, could be in a variety of forms, such as cultural healing practices for example, in a a tribal education setting or community setting. They'll promote activities that address mental health stigma. We think this is really important and hope to enable the coach to, or for the coach to enable students to see that having struggles is not something to be ashamed of. We expect and have heard that the coaches support um, uh, having or coaches have rapport with their students as well as staff and parents, and they are a champion at their school or community in their community setting. The second activity that they are responsible for is the screening. And here, what we're talking about is a very broad screening. We look at the responsibility of clinicians to do clinical screenings, whereas there are kinds of screenings that they can do using these basic kinds of tools. And then to engage and triage them to others that can do tier 2 and tier 3 interventions. Um, and developing school-wide wellness promotion activities. Next slide. Care coordination and extension is just as it sounds. The idea here is for the wellness coach to be able to interact and refer kids and youth to the appropriate personnel on the school side or in the community setting. And in the process, develop strong relationships with their partners that enable the students to receive the appropriate kinds of services. And accordingly, they serve as an advocate for children to get the services that are appropriate. Individual support is really pretty basic. It's drop in, check out, maybe doing calming space, having a calming space, those sorts of activities. Both at the individual as level, and then, as I'll mention in a moment, in the group setting. So, next slide. So, in the group setting, the idea is to lead non-clinical skill building activities such as mindfulness and anger management, to lead and co-lead culturally and gender-specific groups, partner with school-based health clinics and wellness centers to support the work of therapeutic groups, and co-facilitate peer-to-peer programs. They can also facilitate restorative justice circles, which has in its own way a healing effect. As coordinators, they are able to support campus clubs, crisis referral includes being part of the broader team on campus or in the center so that they can connect kids to services, to clinicians as appropriate, and to follow up, which is what postvention refers to, is doing follow up when there are school tragedies through tools like healing circles and reentry circles. Crisis referral also refers to healing and culture building activities when there is a school tragedy, as well as doing things like youth mental health first aid and QPR in crisis intervention, which is question, persuade, and refer. Next slide. There are two pathways to becoming a wellness coach. for certification, the first step is um, the education pathway. I'll talk next about the workforce pathway. So the education pathway, you have to have a high school diploma or equivalent um, to be a wellness coach. One, an associate degree, um, in social work, human services, or addiction studies, and then a total of 400 hours. Though, if you have 150 hours, you could start serving as a wellness coach with a registered designation. A wellness coach two builds on the requirements of a wellness coach one by requiring a bachelor's degree in social work, human services, or addiction studies, as well as 800 hours of total experience. And that experience, I want to highlight, can be practicums while in school, as well as volunteer hours as well. Um, and that 300-hour minimum um, uh, would qualify you to become registered and again serve as a full-on wellness coach. Next slide. As I mentioned, we also have a workforce pathway. For the Wellness Coach One, in addition to the 3 degrees as an associate, um, you could have a degree in child development and early intervention, psychology, or sociology. And we require that you have 1,000 hours and have worked in a mental health, social work, child welfare, or addiction substance use setting. And the Wellness Coach 2 builds on that Wellness Coach 1 workforce pathway designation um, in the same degrees, but requires 2,000 hours and the same type of work experience. Next slide. So we got to the design of the wellness coach profession through a series of efforts. I should say, standing up the wellness coach now. Beginning in the summer of 2023, we launched a marketing campaign to create awareness that the wellness coach profession would be launched. And in January, we actually launched the employer support grant program that many of you currently have, announcing awards in the summer of 2024. Certification itself began in February of this year. In the spring and summer, we offered scholarships. And we're now in the first cohorts of standing up the educational programs where we're designating California State Universities and community colleges as having core curriculum that will assure a student that they have content that meets the requirements for certification. And then finally, working with our sister agency, the Department of Healthcare Services, we're rolling out the Medi-Cal and commercial insurance reimbursement coverage. Next slide. We don't have any appendix. I apologize for that. At this point, my colleague hopefully has been answering questions, and I see that Ali has included a link to our website, and I will now pass it along to my colleague here, Sarah D. Duncan. Thank you.
Thanks, Anne. Hi, everybody. I'm Sarah D. Duncan. I'm from Eureka City Schools in very, very, very northern Humboldt County. For those of you who don't know, and you can go to the next slide to kind of talk about our area a little bit. Oh, talk about me. We can definitely move on from that. I am the Wellness Center Coordinator here. I'm a licensed marriage and family therapist. I also oversee all of our mental health and wellness grants for our school district. So Humboldt County, as I said, is very, very northern. We're not quite to the Oregon border, but we're very close on the coast. We are a very large county and a very rural county. We have we're very spread out, and Eureka is the biggest city in Humboldt, but we're kind of in the middle. So there are school districts and schools and communities, like tribal communities, that are, could be an hour away from us, but we're still all Humboldt County. So it's got that real rural vibe. Eureka City Schools is the largest school district in Eureka and Humboldt County. We have 4 elementary schools, 2 middle schools, 2 high schools, and 1 preschool, as well as a family resource center. We have approximately 3,500 students enrolled, and we have 78% Medi-Cal eligibility, so eligibility for free lunch, Medi-Cal. All of our schools are Title I schools. They're all in differentiated assistance. That's just to kind of show you the kind of demographics that we're dealing with. We have a very high poverty level. We have some of the highest rates of McKinney-Vento students as well in our community. So we have lots of high rates of foster care and homelessness where we are. So that's a little bit about where we are and a little bit about our school district. Next slide. Oh yeah, I like to point this out right away. I like to be very transparent because we have created a really awesome program up here. And a lot of people are like, how'd you do that? And I'm like, because I got a bunch of money. So I like to be very, very transparent that, of course, we know everything's easier when you have funding. So that's why I like to be transparent about where our funding comes from and how we use it to create these really robust and layered programs. So we have the school-based mental health service provider grant from the U.S. Department of Education. This grant essentially, I say, it funds our stuff. So it funded the creation of our 8 wellness centers. We have 1 big wellness center, and every site has a wellie. We call them. It's like a satellite wellness center at every single one of our sites. So all of the things we needed to outfit those spaces were paid through this grant. It also allowed me to hire 4 credentialed, 2 licensed school social workers. So I have 4 full-time mental health service provider and an administrative assistant. The next year we got the Project Aware grant through SAMHSA, which basically funds my position. It funds a full clinician for me, a funding analyst as well. And then essentially a bunch of money so I can have contracts with community partners, which has been awesome. And then finally, and I was so excited to get this, it was a whim, but we also received the Employer Assistance Grant from HCI for certified wellness coaches. I only put in for 5. I wish I had done 9 now, but that's it. But I got the 5, which essentially pays for these 5 wellness coaches and for the supervision of our wellness coaches. How we are choosing to use them, I'm almost done hiring. I have 1 more. We ended up having lots of people who were already in like similar roles. So I think we've only hired 1 like brand new from the outside person. Most of ours have come from roles, people who were already occupying roles in our wellness centers or in our schools that we were able to hire on now as wellness coaches. So that's really exciting. So far I have 2 working. 1 was actually able to get their Wellness Coach 2 certification. So I have 2 that are working right now. 1 is working in our Family Resource Center. So essentially kind of what they're doing there is they're doing a lot of groups, small groups, interventions, and some individual work with specifically McKinney-Vento students. Again, I think I mentioned that we have a really high percentage of McKinney-Vento students. So the wellness coach has been able to really focus in on some of those families with like a little bit of higher need and been able to kind of help get them through the systems. And then I have 1 at the high school right now, and really it was interesting to hear, Anne, your list of things. I was like hearing you and I was going, oh yeah, check, check, check. We're doing all those things. That's so great. Because I was sort of guessing what they would do. But like, so something for instance, we're also implementing Sources of Strength, which is a evidence-based program for suicide prevention and intervention. And my wellness coaches are my adult advisor anchors for that program. So they're the ones who are working with the young people to get them organized. They're doing school-wide events, promotion of prevention strategies, prevention, messages of hope and strength. So the wellness coaches are really working with the young people to get those messages out and thinking about how they want to do school-wide programming for everyone. They're also working together. My wellness coach and my youth go and do classroom presentations. So that's been happening. They're also going to be working in our wellness centers. So they're also kind of going to be anchoring those spaces for us so that there's always an adult staff person there able to connect with a young person or help them if they need to. And what else? Sorry, I'm talking really fast, but I want to get through it and respect everyone's time. Okay, my time's almost up. The other cool thing that I wanted to say, because I think Vivon's on here, so we also are in partnership with Cal Poly Humboldt, which is our good university, and they are also excitingly have a wellness coach, I guess class. It's a class. So we actually have a shared student right now. She's our little guinea pig, so she's in the class at Cal Poly and also working for us. Getting her hours and kind of helping us learn how we're going to create our training program for them, what she needs, what she's getting from school, what she needs to get on the work site. And we're just really excited. These positions are really exciting for us. Again, we were able to hire like clinical people, and I'm in my 4th year with this, and what I started to realize is there was a lot of need before, as you said, and preclinical work that needed to be done. And so I was really trying to find a way to fund and find positions for that preclinic work, and this is exactly it. So we're really excited to have that and appreciate the opportunity. And I'm going to pass it on to Christina. Oh, sorry, there's more stuff we're doing.
All right, good afternoon, everyone. So my name is Christina Alviso, and I am the district psychologist for Ceres Unified School District. And I, along with our coordinator of student services, help oversee and support not only our certified wellness coaches, but also our social emotional support staff and our mental health clinicians. Next slide. So Ceres Unified has a population, or actually the city of Ceres has a population of about 50,000. Ceres Unified in particular has we have 14,000 students. We consist of 20 neighborhood schools. So we have 2 high schools, 2 dual language academies, 1 leadership magnet school, and then 1 K-12 charter school. Almost 80% of our students do participate in the free and reduced meals program. And then as far as demographics go, about 33% of our students are English language learners. And then there is a breakdown of our enrollment by ethnicity. Next slide. So we here in Ceres Unified, we have had a position called the Student Support Specialist position, and we've had that position here since 2015, and it is beautifully aligned with the wellness coach position. And so we have been able to, when receiving that Certified Wellness Coach Employer Assistance Grant, we've been able to certify many of our student support specialists who have now turned into wellness coaches. So we have about 1 student support specialist / wellness coach per elementary site, about 1.5 for each junior high, and then we have 3 assigned to each high school. Next slide. And to give a little bit of background about what supervision looks like for our student support specialist slash wellness coach, we do have district level supervision, which involves me and then the coordinator of student services. But we also have some site level supervision from administration, learning directors at our secondary sites, and then our school psychologists who do a lot of work with our student support specialists and wellness coaches, and they facilitate what I would equate to those service team meetings that bring together, the psychologist, clinician, wellness coach. We have social skills facilitators, community liaisons to really discuss students and their needs. Next slide. This is just a little bit of a breakdown with what training looks like in our district for this position. We do have some designated PD days where we do provide some formal training. We have monthly collaboration meetings where we bring all our wellness coaches, student support specialists together to really provide updates, talk about challenges, successes, things like that. I've also incorporated, they're called monthly core team meetings for job alike collaboration for them to come together and talk with each other, share ideas, and they meet at their, they'll pick one of their school sites to meet. And then, so one important thing is definitely QPR, question, persuade, refer, suicide prevention awareness training. Next slide. Outside of the district, we do take advantage of any county trainings that are related to mental health or social emotional learning. So we will sign them up for those as they come along. We will sign them up for webinars or training online. And then one of the key things that I like to do and we like to do is really solicit feedback from them and what they need for the upcoming school year. Next slide. So some of the roles, a lot of these were already mentioned, but a big part is their visibility, and they are very active members of the school site community, building rapport. They are communicating regularly with staff, parents, teachers, other service providers. They are really monitoring the services that they are providing. They are members of the crisis response team to really be a supportive adult on campus and can make, know those signs when students are in need of additional support, and they receive training in youth mental health first aid. Next slide. They are able to lead community circles for prevention, but also intervention through restorative circles using restorative practices. They also are part of our alternative to suspension program to teach skills to students, and our secondary wellness coaches are trained in brief intervention as a tier 2 intervention for students who have been caught with a substance on campus. They do tons of classroom presentations at the beginning of the year and then again in the winter that are all based on the universal screening data and are centered around teaching CASEL competencies. Next slide. They are part of our PBIS, the school site PBIS teams. They support various clubs. They do help operate those wellness centers that are at each campus, and they are really an important member of the MTSS teams, and that's where that care coordination and extension component of wellness coaches come into play. Next slide. So yes, so we are currently as a district, we're working on that CYBHI implementation plan. We have 12 current wellness coaches, and we're working to achieve operational readiness for Medi-Cal enrollment and billing. We do have 14 that do not currently meet that certification criteria, but they are currently enrolled in a master's program, so they're well equipped to do the work on site. Next slide. And just for sustainability, for our student support specialists, we've used LCAP funds in the past to support that position since 2015, but we are really excited to be part of that new multi-payer fee schedule, and that will help offset some of the LCAP funds that we use to fund these positions. And I am going to pass it on to Tanya.
Helps if I unmute. Good afternoon. I am Tanya Calabretta, and I'm with the Santa Clara County Office of Education, Youth Health and Wellness Department. I am an assistant director, and I help with our wellness programs, and that is where our wellness coaches are going to come into play. Next slide, please. So our wellness programs, a little bit about them and the demographics and kind of what they look like. We are a county office of education, but we help support and run 22 school-based wellness centers throughout the county. Many of our LEAs and schools operate wellness centers that are staffed by them as well. We have 2 mental health and wellness coordinators that work for our department and oversee both our clinicians, which we have 15 mental health specialists, and then we have 18 wellness center liaisons. Those wellness center liaisons, I'm going to talk about how they're who we are utilizing to do the work of the certified wellness coach. Those locations are among lots of different types of education settings. So we have court schools, we have alternative high schools and community schools, middle schools, elementary schools, comprehensive high schools, and also K through 8. So we also have an interesting one that's a 4th grade through 8th grade site. So for wide variety of students that we're serving, and our staff are very well equipped at serving those students and the demographics across Santa Clara County. Next slide. So our wellness coach journey, we are a recipient of the HCI Employer Support Grant. So we actually qualified for one coach, wellness coach 1 and 9, coached at the 2 level. And then we also have supervision, which is fulfilled by our coordinators. So our current liaisons, which I'll share with you what the work that they're doing already, most closely matched. So we're actually not looking to hire unless those positions become vacant. So unless there's a transfer, or we've actually had situations where a school district has opted to staff those positions themselves. And so they've hired on our staff and they've become fully integrated parts of their systems there, or their campuses. So we are not hiring. We looked internally at what our staff was doing. And we ultimately had the staff that was serving students doing a lot of the work already that is defined by the wellness coach kind of roles and scope of service. And so we really just want to be more mindful and expanding the services and opportunities that the work that they can do for our students. And being strategic about how those services are defined, how they are scheduled and coordinated, and really taking the value and the skill sets that our staff have, which some of them are actually on the call today. So hello and welcome. And really honoring that and what they're doing and providing for our students on a daily basis already. So like I mentioned, our coordinators supervise these staff, they support them through the process of certification. So what that looked like is those 10 that we identified that fit through their bachelor's or their associate's degrees areas, that they went through the certification process, which thanks to HCI has actually been really easy from what I've heard for those staff members to do the verification of their hours, because like I said, they're already in positions of which they've been doing this work through their positions with us, or most likely also in their other positions prior to working for SCCOE. And in the future, as I said, if there's vacancies that we do hire for, we're going to be looking to make sure that they meet those qualifications or that they're already certified as wellness coaches. Next slide. So in that, when we looked at this is a very brief, very formal description of what our wellness center liaisons role was, but they really are doing, like a lot of my former colleagues described, they're doing that care coordination. They're the face of the wellness center. They're doing that intake of students when they come in. They're doing a lot of management and oversight if a clinician is with a student in a session. They're helping run the space. They're doing a lot of triage. They're doing the outreach. They're a lot of who is our point of contact for our community-based organizations and setting up and scheduling those services. They're doing some data entry and records. They're establishing those partnerships. Some of them create newsletters. Julio, who's on here, actually developed a parent advisory as well for wellness. And then they're also running our youth advisory groups as they've developed them, doing referrals, the clerical support. So they're doing a lot of the heavy lifting already. So we wanted to make sure that they were getting that certification and then that we could build them into that sustainability plan as well. So next slide. So that sustainability, we are a part of cohort 1. So we're hopeful in January, once they're recognized by DHCS, they are going to be trained alongside our clinicians in the documentation process with the EHR to be able to be a part of the billing and help with some of the psychoeducation and the work that they're already doing. Some of our barriers, just like my former colleague presented, it's not all of our staff qualify through the workforce pathway, but it looks like some of them are on their way to do that. But still focus on student service. Whether we have a billable provider or practitioner or not, we're still going to provide those services and we're going to still keep that staff regardless. They're very well qualified to deliver those services. The other barrier is just working with job descriptions and union language and making sure that we really are holding true to what our staff have committed to do in their current jobs. And making sure that we are helping support our other LEAs with that work as too. The other thing that I wanted to note is in our work with the capacity grant, we are helping support our LEAs in their acquisition and use of wellness coaches too. So I want to thank CSHA in offering this webinar too, because it's really helpful in our work in partnership with our LEAs in Santa Clara County to help them in their endeavors as they look to hire this position in workforce as well too. And with that, I think I'm handing this off to my colleague, Lauren, in Santa Cruz County. Thank you.
Thank you, Tanya. Can you all see me? Don't see me. Okay. Hi, everyone. My name is Lauren Fine. My pronouns are she, her, and I'm the Behavioral Health Director here in Santa Cruz County. Santa Cruz is a mid-sized county. We're about 260,000 people, and we're on the coast, just nestled in between Monterey and Santa Clara. When this grant opportunity came along, or next slide, please. We really took a consortium model approach. I don't know if anybody else spoke to that on this call yet, but I just knew that our districts weren't going to have the bandwidth to really fill out this application or really wrap their head around what this even meant. So I set up meetings with each of our districts and kind of just pitched what wellness coaches were, how it could fit into their current infrastructure, and what positions they might already have that align with the scope of this position. And so we were really excited. We submitted an application that included participation from all 10 LEAs in our county, as well as one community-based organization, for a total of 46 positions. And we were awarded about 75% of that for 32 positions. I would say about 20% were for new positions, and then 80% were for existing positions. I think a lot of districts were really hesitant to create new positions just because of the economic climate and ESSER funds going away, and really the uncertainty of what this could look like moving forward. And we applied for all of those positions to be certified wellness coaches. One of the reasons we went for a consortium model was twofold. I think with SBHI and the fee schedule and all these initiatives coming down, we just recognized our districts, most of them don't have the bandwidth to really wrap their head around all of these awesome mental health opportunities coming down from the state. And so more and more, we've been looking at a consortium model where the COE really can become this kind of local expert and then support the districts in onboarding into whatever initiative it is. So this worked out really well for us. I also think as a COE, we felt a responsibility to really commit to creating more capacity in our system, and really felt like the wellness coach just filled a huge gap in our behavioral health continuum, where there's a lot of people already doing this work, but didn't really have the scope or structure to define what this role was. Next slide. So I mentioned that we looked at existing roles in schools, and these are just a few of them. We are in the process, like many of you, of opening wellness centers. And one of the roles in our wellness center model is called a wellness center navigator, which is somebody who's a classified staff person. They're your eager kind of social workers in training who just haven't gone back to grad school. And most of them had the educational background to fit the certified wellness coach. So that was one area that really aligned in the scope of this position. Another place was for family engagement coordinators at sites. These are folks that are really family partners, supporting family members and being connected to services outside of the community. And this wellness coach designation would also allow them to really build some of the skills for the family and the student. And then the last one was the alignment with some behavior techs in our special ed classrooms. That seemed like another place that district recognized that there was a lot of overlap of what was already happening in their sites. Next slide, please. So as a consortium, we saw a lot of opportunities. You get a stipend for each position, and so we had a healthy amount in that kind of training budget. So we have a supervision cohort, which is a 1-to-4 model. So 4 certified wellness coaches for every 1 supervisor, and they meet every other week. And really, the goal is to create a community amongst our wellness coaches because they're at different sites all over the county, that they have a place that they can come back to, really work with what's coming up for them, and to build those relationships. The supervision cohort also is helping with their certification process, which is fairly easy and straightforward. We've had, I think, 1 or 2 people already go through it, and also to do some case consultation. We also developed a training series that's comprised of the domains you see on the left. So mental health first aid to really help the wellness coach be able to navigate crises, training on cultural competency, one on SOGI 101, which is sexual orientation, gender identity, and expression training. And then connecting them with somebody at their site to help them really understand the particular climate of that school, their SEL curriculum, what PBIS looks like, to ensure that while they're getting all the support from us, they're also really integrating into the site's culture and the programs that are going on the site level. Another training piece is on ethical and legal mandates, and then how to build those relationships and build their capacity for coping skills and whatnot. The one challenge we've had with the training series is while it's been a great idea, is people have been coming on at different times, and so trying to schedule it so that people are able to access all these pieces of the training series, even if they didn't get hired or identified until later on in the process. Next slide, please. So I would say there's been a lot of awesome pros to this program, and there's been some challenges or barriers. The pros is that it's really created a scope for existing staff, so really defining what staff are already doing in that kind of scope that comes along with the position. It's really integrated into the school's mental health MTSS system, is providing a lot of those tier 1 interventions, and that there is an ability to sustain these positions through the fee schedule. I think some of the challenges we're up against is, Santa Cruz is really expensive. And while we're so thankful for the funding, it doesn't fully sustain the position. So we've been working with districts of how they can offset the remainder piece of the position. That with the fee schedule, we don't have a reimbursement rate yet. And so it's hard to really gauge what this will look like moving forward. And some of the, most amazing parts about certified wellness coaches, the fact that they're in recess and they're kind of thrown in different situations. Because the fee schedule is based on a medical model, it's challenging to bill, at least at this time, for some of the services that the wellness coaches are providing. I would also say, I think that coming from the world of behavioral health, lived experience and work experience goes a long way. And I think one of the other challenges we're up against is just that there's a lot of amazing people in schools that don't qualify just because of their educational background. And I think that's my last slide. Yep.
Sorry. I'm going to ask all of our panelists to turn on your cameras because we do have some time for Q&A. And I will also just congratulate our panelists because everyone stayed right on schedule with their time. So thank you all for that. So I'm going to, well, first of all, if folks haven't been looking at the Q&A, there's already been questions that have been answered there. So you might want to review those to see if any of those are aligned with some of the questions that you have. And you can also just put them in there now or put them right into the chat because we do have a few minutes. And I'd love for our panelists to be able to answer those live. So I'm going to just start with a question that was raised in the registration. And this is really, I think, for the HCI folks, a question about the evaluation plan. Like, what is HCI planning anything to generate evidence or knowledge from how this is going so far or down the road?
Thank you, Amy, for the question. I think I was thinking about that as the presentations were being made and the enormously rich information that I'm learning today as we hear the wellness coach in practice. And we're thrilled that there's a lot of alignment with the vision and the field. We are collecting data from grantees, and that data will be used to do evaluation. It will be primarily a quantitative analysis, but my hope is that we will be able to do some additional qualitative analysis. So stay tuned to see if that's possible. But yes, evaluation is critical. Keep in mind, though, that this isn't the typical sort of grant where you try something out, evaluate it, and see if it sticks. It's really more about learning how the profession is working out, and through our monthly meetings that will soon be starting. We had one this week. We'll have more going forward with our grantees, that there will be information exchange and learning opportunities. The reason I raise that is at this point, we plan for the fee schedule to come on board long before the grant period ends, so that there is a runway for programs to get fully based and settled in before they start billing against the new multi-payer fee schedule. I will say that right now we're waiting for the estate plan amendment that to be submitted and approved to Centers for Medicare and Medicaid, CMS, and that we've seen some preliminary drafts, and we're very encouraged by a recognition of the scope of activities of that wellness coaches will be delivering. And so I know the question was about evaluation, but I thought I'd take a chance to also note that we're hopeful that that will be more generous than I think we've all kind of worried it would be.
Thank you so much for adding that, Anne. I know many people are really anxious to know how to plan for sustainability when we just don't know any numbers yet. So I'm glad that you're feeling hopeful, and we're really excited to hear about that state plan amendment getting through. I know that there was a question about any more rounds of employer support grants, which I know that you responded that there were not. But in terms of the scholarships that have been available, can you talk a little bit about that?
We're very excited. In January 2nd, we will be opening a new round of scholarships for the wellness coach to secure an associate or bachelor degree candidate to get their degree or complete their degree. And we're aiming for a mid April announcement. So earlier than the last year, then I should say this calendar year, and they'll be on an annual basis thereafter. And we anticipate a funding stream that will support them for several years going forward.
Great, thank you. I want to direct a couple of questions to our panelists who are on the ground in schools, in districts. Because a question has come up about what the response has been in your districts, both sort of at the school site level of this new role, and is this somehow duplicative or not, fitting with your staffing, or from the administrative level, just sort of how that process has been of people learning about this new role. Does anyone want to respond to that?
I can share. We've had the existing student support specialist role, so getting some of our student support specialists certified has been really seamless, and it's just like an additional like certification that they now have. But I mean, we've received the grant, so people are very excited about it. And the role is so critical in each and every school site that anything having to do with a student support specialist wellness coach is, received very positively.
Great, good to hear. Any other responses to that from our panelists?
Yeah, I'd agree in positions that people are already doing this work. I think it's been pretty seamless. Working with LEAs through the capacity grant, it seems that a lot of LEAs and districts and sites have similar roles, whether it's a student support specialist or a liaison or a community worker. There's lots of ways. I think the barrier or the hiccup might be if they're trying to do the workforce pathway, the education that they have might not fit, like I see in the Q&A, like a political science bachelor's or things like that. But we have had a few people look into the scholarship for maybe pursuing an AA because they have the credits and coursework to do that. And maybe they just hadn't thought about it before. So really appreciative of those things. And then a lot of COEs have educator prep programs that also offer pathways and are starting to offer pathways in mental health and wellness specialties. So there is the opportunity there too, that I think will be helpful and help support some of those barriers for folks that are excited about this opportunity.
Great, thank
I want
you.
to touch on something Tanya said because while we can't, we have a process we have to go through in state government, but we've heard loud and clear about the limitations of the degrees required to be eligible for certification. And so we are looking very earnestly at expanding that, and we will have some changes by the end of the year. And so stay tuned. Yeah.
Great. Yes, that's great to hear. And I know that there's other questions that were submitted that are specific to a certain school or degree. So I really, since we don't have a lot of time, I encourage you to send those questions directly to HCI. If someone can throw that into the chat again, so people can follow up on any other specific questions. We know there's a lot of complexity to it that we're all trying to understand, and particularly on like who qualifies and how do you know that. We are so at the end of time, but I want to just close by saying thank you to our panelists. I have a couple more slides I want to go through, just a little bit of further information for you. Can you see those slides now? Okay, great. So just as I mentioned earlier, CSHA, part of what we do is webinars, convenings, trainings. We've got some upcoming ones to check out if you're interested, or share with members of your teams. We also have a lot of resources available on our website, and just some of our key resources are in the QR code that you see here, and also this link that Ali is putting into the chat. We have a very comprehensive guide to starting a school-based health center. Really gets into the nuts and bolts, and has been really helpful for lots of folks who are kind of wondering where to start. And we really want to stay connected with you. If you are not on our mailing list, I would love for you to complete our link that will let you be part of our mailing list and find out about other opportunities. If there are webinars that you would like us to host, because we know there's so much information coming out that needs sometimes a lot more translation or time to digest, or hear from folks on the ground who are doing the work, please let us know that as well. We love to do this. We love to bring together experts who are in the field, on the ground in schools, really thinking about how to make sense of all of these statewide initiatives and bring them to our students. So again, thank you to Anne and to Tanya and to Christina, to Sarah D, to Lauren, to Christian, and we will see you at the next convening.